The Doc is In is sponsored by Amada Senior Care.
Fox 56 News Chief Medical Contributor Dr. Ryan Stanton joins us again this morning.
Earlier, he looked how measles is becoming a growing concern for doctors. Now it's time to focus on which areas across the country, Doc, are being hit the hardest.
Yeah, so this has been breaking out a little bit more over the last number of years. We talked about that earlier, but we're going to dive into now some of the areas where we've had some increased numbers, and specifically in Chicago. So earlier we talked about the risk and how the vaccination is important. This year we've had multiple pockets of outbreaks across the country, especially in areas with concentrations of unvaccinated individuals. One of those outbreaks has occurred in Chicago, where a migrant shelter has been the source of multiple cases and potentially 1,900 exposures to the virus. This temporary shelter was designed to house about 1,000 people, but overpopulation means closer proximity of the individuals, which does increase the risk of exposure and spread. I talked with Dr. Nick Cozy, who is a regional EMS medical director in the Chicago area, who's assisting with the local medical response and preparations. Thankfully, the CDC and public health authorities have intervened and now vaccinated the remaining eligible inhabitants of that facility. The vaccine has decades of history and is incredibly safe with minimal risk and prevents 97% of infections. Unfortunately, with dropping vaccination numbers and concentrations of unvaccinated populations, gives measles the chance to spread, and this is an equal opportunity virus that can impact anyone that is unvaccinated. So the key here is it's preventable. That's the best tool we have against many of these viruses. So getting the vaccine, making sure that they're up to date, not listening to the chatter, the clickbait on there about the dangers of viruses and of the vaccines and that thing. You know, this is incredibly safe. It's how we prevent these diseases and save lives, especially among children and higher risk individuals.
Have you noticed any concerning trends in Kentucky when it comes to the measles?
Thankfully, we've maintained our vaccination rates pretty well, but we still have migrant populations and concentrations of unvaccinated. So keep that in mind as an opportunity to watch and make improvements moving forward.
All right, Doc, great information as always. Thanks for keeping us up to date on measles.
Appreciate it.
You read that perfectly this time.
Yeah, I did. Just almost. Almost.
I didn't even notice. It was great. Thank you, Doc. The final hour of our show is coming up after the break.